We will talk about fatigue, top 7 causes and treatment. Fatigue is subjective experience of reduced energy. A person describes it as weariness, sluggishness, or low energy. Medically, it is difficulty to initiate or maintain voluntary mental or physical activities. Fatigue is not normal tiredness. Fatigue persists despite rest. Fatigue is a complex and multifactorial process. If we say what is main players, they will be
impaired mitochondrial function. Mitochondria are energy powerhouses in our cells. Low mitochondrial function means directly to low energy production in cells, and it is common in chronic diseases, during aging, and in chronic fatigue syndrome. The second important player is depletion of adenosine triphosphate ATP reserves in cells. It is the primary source of energy, especially in muscle cells, and the person feels tiredness. The ATP deficiency caused fatigue is common during intensive exercise, heart failure, and chronic ischemic disease. On the other hand, both high and low serotonin also can cause fatigue. For example, during prolonged exercise, serotonin increases and the person feels tired. While during depression, serotonin decreases and the person also feels tired.
Decreased dopamine level, which further reduces motivation and alertness. Such fatigue is common during Parkinson's disease, depression, and chronic stress, and lower noradrenaline, which causes lethargy and low focus. It is more common during chronic fatigue syndrome, attention deficit, hyperactivity disorder, and postural orthostatic tachycardia syndrome. Hormones also play a role, and many other factors. That's why fatigue is very complex and difficult to point out one specific cause. The most common cause of fatigue is sleep problems and lack of sleep. Sometimes the person is unaware about their sleep-related problems. For example, deep sleep state is the stage 3-4 of non-REM sleep, and it is associated with rest and immune system support. Also, growth and repair happens at this stage. When deep sleep phase is not enough, it is associated with physical exhaustion, muscle aches, and reduced immune function. Aging, obstructive sleep apnea, and chronic insomnia are associated with insufficient
help for healthy sleep. Regular daily exercise is important. Avoid stimulants like caffeine, alcohol, or heavy meals before bed. Reduce screen time at least 1-2 hours before sleep. From medications effective. Melatonin up to 5 milligrams before sleep, helpful for circadian rhythm issues. From sedative short-term use of zolpidem and benzodiazepines are helpful. And modafinil for daytime fatigue. It's used for wakefulness during daytime, not for sleep at night. The second most common cause of fatigue is stress and anxiety. During stress, cortisol levels increase. In the short term, cortisol provides energy mobilization, but in the long term, it causes neurotransmitter imbalance. It suppresses dopamine and serotonin, causes muscle breakdown, which further reduces insulin sensitivity and causes energy depletion. Cortisol disrupts the deep sleep phase and REM sleep, which are both restorative.
The treatment of anxiety and chronic stress is psychotherapy, stress management, exercise, anxiolytics for short-term use like benzodiazepines or non-sedating agents like buspirone are used for severe cases. Antidepressants when it is combined with depression. Adaptogens from supplements like ashwagandha and radiolea rosea help to modulate cortisol levels and improve stress tolerance. Omega-3 fatty acids and lean protein are also important for their anti-inflammatory and restorative composition. The third most common cause of fatigue is depression. 90% of people who have depression also have fatigue. Fatigue is a core symptom of depression. Dopamine, serotonin, and norepinephrine deficiencies are responsible for decreased mood and fatigue during depression. Also, depression often leads to withdrawal from activities and exercise, and physical inactivity leads to deconditioning, which can worsen fatigue.
Treatment of depression involves antidepressants. Usually selective serotonin reuptake inhibitors like fluoxetine, sertraline, and citalopram are used. Serotonin norepinephrine reuptake inhibitors are also used like venlafaxine and duloxetine. Among norepinephrine dopamine reuptake inhibitors, bupropion is used. The fourth most common cause is poor nutrition and dehydration. Especially deficiencies of iron, vitamin D, and vitamin B12 can cause fatigue due to impaired energy production. The most common cause is infections, like viral infections. For example, flu, COVID-19, infectious mononucleosis, and cytomegalovirus. Also, more serious infections like hepatitis viruses and human immunodeficiency virus cause fatigue. Weakness associated with infections can last for months or more. In the case of influenza and COVID-19, fatigue usually lasts several weeks, sometimes much longer. Infections cause fatigue because they produce pro-inflammatory cytokines like interleukins and tumor necrosis factor, which affect energy production and neurotransmitter balance. Obesity is the sixth most common cause of fatigue. 40 to 60% of obese individuals report significant fatigue compared to 5 to 10% in the general population.
Excess weight increases energy demand, while inactivity promotes muscle deconditioning. Adipose tissue, particularly abdominal fat, secretes pro-inflammatory cytokines. They cause chronic, low-grade inflammation in the body. Excess fat, particularly in the liver and muscles, promotes insulin resistance. Impaired glucose uptake by cells reduces energy availability, leading to fatigue. Obesity is often associated with depression, anxiety, and low self-esteem, which can amplify perceptions of fatigue. And the seventh most common cause is thyroid problems. Both hypothyroidism and hyperthyroidism can cause fatigue. Hypothyroidism slows metabolism, while hyperthyroidism causes inefficient energy use. The conditions also can cause fatigue, like chronic fatigue syndrome. It is unexplained, persistent fatigue which lasts more than 6 months and is not relieved by rest, associated with chronic inflammation.
Adrenal insufficiency, Addison's disease, causes fatigue because of cortisol deficiency. In this case, glucose metabolism, blood pressure, and stress responses are dysregulated. While it's not common, it's life-threatening if untreated. And anemia causes fatigue due to oxygen insufficiency to the tissues. It is critical to identify anemia by blood tests because it can have multiple serious causes.